Hi, everyone, and welcome to Office Hours today. I'm Laura Pata, AVP of Customer Success here at Infinix, and I'm filling in as a host of today's Office Hours. Today, we're diving into a topic that continues to challenge healthcare organizations across the country. Favorite word of the industry is prior authorizations. Our session today is called "Changing the Oncology Prior Authorization Story with Exact Sciences." We're going to explore what makes oncology prior authorization so unique, how Exact Sciences has navigated some of those challenges, and the role that automation and collaboration play in making the process smoother for both staff, providers, and patients. So I'd like to welcome today Liz Durkin, Manager of Revenue Cycle at Exact Sciences. She brings in a wealth of knowledge into one of the industry's leading leaders in cancer diagnostic manages, company manages, Exact Sciences. Very high volume, high stake authorizations, very complex. So I appreciate you joining us today, Liz. Welcome.
Thank you. It's nice to be with you.
Yes, we're excited to have you today. So, anyone who is new to office hours, this is an open, informal conversation where we talk about the real challenges and practical solutions happening within the industry. So, starting with prior authorizations, and I kind of like to get a debrief in terms of, what were some of your challenges before Exact Sciences faced prior to partnering with
Mhm.
Infinix? How automation and AI have, made a difference behind the scenes. What trends are shaping oncology prior authorizations for the year ahead, and then we'll save some time at the end of the conversation for some audience questions as well. So please feel free to drop those in the chat as we go. All right. Um, so before Infinix came into your lives, what were some of the biggest prior authorization challenges that you had? Whether it's denials, delays, missing documentations, which is still happening. There's no way around that one. And how has it impacted your team, your operations, and providers and patients?
Sure. So Exact Sciences, we are a laboratory, a cancer diagnostic lab. So we're basically the middleman between the ordering provider, the oncologist, and then the insurance. We have various tests from screening to these precision oncology, more complex cancer related tests. Our one of our largest ones, the breast recurrence score. It lets you know how likely it is that cancer will return somewhere else in the body, but also how the patient's treatment, if they're going to respond to chemo.
Mm,
So we work under a lot of pressure of time when the
Time
patient is
sensitive for sure, with
absolutely.
patients waiting to get the results. Yeah.
Yeah, so we really have our prior auth. One of our hurdles is that you have a very limited window between the order being placed and then the test result going out. So we need to contact the insurance, find out what's needed, and set that up, and also make sure we get all those documents. Like you said, it's hard to get medical records. It's hard to um, get path reports because they're done by a pathologist outside of the oncologist, and it's coordinating all of that. And that was a problem. That was something that we had to work through, as well as medical necessity. And knowing, how can we do better at understanding why we're getting the denials that we're getting. So that was where we started. Um, we also were bringing billing in-house. So we were leaving one vendor, pulling everyone, all of our tests into Epic, which is its own beast of a software that
Yes.
we have to learn, and also
Nice way of putting it.
it's great. It's intelligent. It's perfect, but we also have to find a company that can work with us and Epic.
Mhm.
Um, and so when we were looking at companies like Infinix, my role and what I was looking for is a company that would understand the time limit that we're under, the pressure that we're under, all the various like clinicals and documents that we need, understand payers, but not be a data entry company.
Mhm.
Meaning that, like, I've worked at other previous organizations where our internal PA team has to handhold the vendor. And
Mm.
every question that's asked them, like how many genes are in this test, they would send to us and we would have to
Oh,
answer and
gosh.
go back. Yeah. So it's like we really wanted a smart PA team, someone that really understands PA.
Process. Yeah.
Yeah, yeah. And so it was great when we found you guys and we could um, start that relationship and then also not have any break between one vendor to
Yeah.
another vendor too. It was, I mean, you were there. We were in the same room together when we
Yes.
turned off one and turned on the other.
That was a big day.
Yeah, exactly.
We should have popped champagnes.
We should have, we should have. We were too stressed that day.
Right. So actually the med nest, I mean, I do know most labs, especially with these oncology tests, the biggest denials are due to medical necessity and out of network. Those denials are heavy, very, very heavy across the board. So I know one of the things as you're talking about the documentations, what we have to submit every time in order form, path reports, progress or any type of clinical documentation, but we also do the statement of medical necessity to try to preempt
Mhm.
those back and forth with with the payer and the providers. So,
Yeah.
like how other ways do you think that has been beneficial working with Infinix and how like things are done now maybe than before and tackling some of these issues that keep occurring? That there's really no way around it, but
Yeah, I think that we were offered an opportunity with Infinx to start over again.
hmm
We have been working where it's okay, this is what's needed, this is what, you know, this is the process that we have. Is that the best process or is it something we're just used to? So
right.
certain clinicals is like, is it really necessary? So when
And
we,
specific payers too. We found out this
yeah,
payer doesn't need this one or this one
well,
does that.
yeah, and that's what I loved about the team that we have at Infinix is like you guys were so vocal of Liz, you actually don't need that. We can
Mhm.
get it approved without that. And I'm like, well, then go ahead, run with it.
Yeah.
Or what you're telling us to get is not enough. We
hmm
really need X, Y, and
Much
Z.
more.
So there was a great communication. And also the team at Infinix was willing to try anything.
Yeah.
Um,
Lots of trial and error.
yeah,
Lots. Yeah.
yeah. Facts that call it in. We're finding success over the phone versus a portal or vice versa. Um, and really work
Like
together to create that.
implementing this new language line now for Puerto Rico. Like that's
Yeah,
going to be key. Like I'm excited to see like how that works out too, because it's
yeah,
basically trying everything and everything possible. Like
exactly. Like,
whatever, if this works,
yeah,
let's try it out. You guys have allowed us to do that. So and it's worked out well.
it really has. It really has. And simple things like Puerto Rico changing our facts to Spanish. That was something that Jennifer on your team recommended, and it was like, yeah, why aren't we sending it in Spanish? It should be, it'll
Mm-hmm.
get in faster and understood faster, and so let's do it.
Yep. And
Not everything has to come from us. All the
right,
ideas is what I
right.
appreciate.
And you guys are so open to that, which has made it just like that much better. It's like it doesn't always have to be this way. Payers change, guidelines change. Like everything's always changing. It's not static. So you have to kind of be adapt to making those changes and
Mhm.
being willing to like let's try it out and see, what comes of it. But this
Yeah.
also kind of leads into how it affects turnaround times because there's a lot of different moving parts in terms of the various statuses, how things get moved through the system from the orders being generated into Exact's provider portal and then getting over to Epic, getting over to Infinix, and then reviewing cases. Like turnaround times are key. And then, but
Yeah.
basically the whole point is making sure that we get this prior authorization completed as soon as possible so those patients can see their tests. So, what do you think's been done, or what do you think could be done, not even related to Infinix, but maybe in the industry that could help improve speed and accuracy, making sure that those turnaround times get tighter? I know it's kind of open-ended
Well,
question,
I mean,
very
if
open.
we could have clarity from the payers of their requirements and
Well, that'll probably never
even
happen.
I
So,
know, because I mean, my internal team for PA, I even nicknamed them little detectives because it's really a search to find out how they want the authorization. A lot of payers don't post anything on their website about it. You have to call and you're given different answers depending on the different plan within the company, and it gets very complicated. So we've worked together on that, and then I like how the reporting that we have been given by you guys breaks it down into breaking every bit of turnaround time into first request for medical records, second request, and how many days are in between that. And, if we're faxing, if we're calling, And we've switched it around a few times since we've started together about 2 years ago.
Yeah.
Do we call first? Do we fax first? Do we email? We started that whole process of emailing providers, which is complicated, and using a company like DocuSign and getting people registered with that too. But we've really been able to pinpoint certain areas where we needed to work together to get it moving quicker.
Yeah, and I actually think this leads in better to my favorite topic with exact sciences, provider enrollment,
Mhm.
because this is something I've learned, even through exact sciences, of the importance of getting your ordering providers with a BAA. Like, have
Yeah,
them sign those BAAs from us because that's going to help expedite the approvals. It's also, payers, like you said, some of them are complicated, some of like to push back, but having that BAA on file allows us to initiate on their behalf. So it reduces the turnaround times because
yeah,
sometimes, majority of the time, depending on the pair, like it doesn't have to go to MD to initiate, right? Like that's something that we don't have to
exactly.
send back to the ordering provider to complete. It's like with the BAA, that basically gives us the rights to go ahead and it designates us to go ahead and act on behalf of that practice. So it's great. A lot of
Mhm.
work in between, a lot of questions, but for the most part, I mean, I think it's valuable. But what do you think? What's your perspective? Like, do you see
Um,
value in this process? Is it just like an
yeah,
extra unnecessary process, like step that we have to do, or?
I think that, ordering providers are always going to push back on the requirement for PA and the workload that comes with that. It's
Mhm.
just something that's always going to be part of prior authorization is physicians not having the time to do them.
Yeah. Do you actually
And
think that
yeah,
prevents ordering providers from submitting authorizations because they know it's like such an extensive
yeah,
process in order to get yeah, yeah.
100%. I've seen it before with certain medications. Like, what's going to be required, the battle that is ahead of you to explain it. So I think it does. I think it holds back providers on ordering certain tests or taking certain actions. Even when it comes down to simple things like an MRI
Mhm.
authorization, they know that, like, well, we can't do the MRI until you have physical therapy and you go through
Yeah.
different treatments, and then we're going to be
Mhm.
able to. And so it slows down how they want to practice medicine as well.
Right.
Um, and we see that here too, when we get questioned or we get orders that are out of criteria, the doctor still wants them done, but then we have to be the middleman to kind of explain it. So that BAA
Mhm.
helps us, get all the information from the provider and take that load off of their hands, and then we can fight for them.
Yeah, because I know you guys have had very large organizations, practices, agree to the
Yeah,
BAA saying like, hey, and then it's a locked additional volume because they're like, oh, cool, like we're covered under BAA and we're ready to go. We'll start submitting orders. And so that's, I mean, I see the value in
yeah,
it. It's just very complicated because it's not, people don't really understand it. And so sometimes like it's some of these ordering providers, like they don't understand
yeah.
it. But it's a pain
Yeah.
environment.
But I mean, PA has grown so much in the industry over the years that every provider is affected by it, and
Yes.
every provider has to do PAs, especially in oncology.
Right.
You can't do anything without a PA. So if we can take the burden off of a company, an organization, a medical group, then it frees them up to do other things, and then,
Yep.
we can then take that and get more volume in from them by
Hmm.
doing that and getting the BAA signed up, so they don't have to do so much on their side.
Yep, I agree. So I mean, yeah, it's a lot of hand holding. It's a lot.
It
It's not. But the process is very simple. It's just a matter of understanding the value of doing it. Like how do you
exactly.
get the message out? To like, no, it's actually a great thing. Like, it's
Yeah.
an amazing tool. It's just like, or, it's a workflow thing. But it's great to have. And it does help with
Mhm.
the burden, obviously, and then
Yeah.
with turnaround times, which obviously is very important with these oncology patients.
Yeah,
Um,
definitely.
and going back to kind of what we were talking about earlier, you mentioned automation, reports, AI. Some of this stuff works behind the scenes that you don't even know. But a
Mhm.
lot of it has been the main lift, I would say, is with the Epic integration that you guys have had,
Yeah.
right? And being able to submit it directly, send the request back, any information in between. I know we're working on some additional medical necessity AI tools with you, some order
Mhm.
ID, document capture, figuring out those order numbers so we can apply it to all the forms. So there's a lot of AI and automation that people may not know that works in the background. But How has it helped you? Because when we first started, we didn't have the integration.
Yeah.
Yeah.
No, and it's we have a high volume of
Yes.
orders, and so getting those orders, we did it the first few months where they were, we manually sent you everything and we manually had to find reports for you, send you the order forms. It was a lot and it took a
Yeah.
lot of, took a lot of work. It was a lot of stress.
Hmm.
So when the automations came in, it opened us up to spending time on real payer issues and
Yep.
not moving documents,
Yeah, like
you
just
know?
getting the data to and from and the correct documents. So yeah, once that was solved for
Yeah.
us, I said we should have popped champagne during that day. That
We
was a
should have.
it was a big, it was a huge undertaking, especially on the exact team, the Epic teams, like and Infinix as well. But we made it, and it's better,
Right.
it improved, and
Now,
we'll
and
continue.
orders go to you
Yeah.
with documents within seconds of them
Yep.
being placed in our portal. So, which is amazing that it goes that fast to you guys. And then immediately you're working it and immediately you're starting that, which is perfect.
Yes. Yeah. It's all time is of the essence, right?
Yeah. Exactly.
So as the volumes have grown, we've seen it month over month. Volumes has
Yeah.
definitely grown over the past couple of years. Payer lists expand. There's more payers being added to the grouper. How do you see that balance, with the stability between both teams on the epic or on the exact sciences side, as well as our onshore, offshore teams, making sure that as volumes increase, quality isn't, impacted or anything,
Mhm.
any insight into that, like how it's been for you and your perspective?
Yeah, I mean, we're in constant communication. I mean, you and I speak every week, if not twice a week. um,
Week, yeah.
Not more than that. And then the operations team, I mean, they opened a Teams chat with us because we wanted a Teams chat, and they all joined Teams with us, and and they started that, and we can send them cases. Could you look at this case and let me know? Could you do
That
this? Like
real time instant messaging, right? Like
instant
between
messaging.
both
Yeah.
teams. Yeah.
Yeah, like there's a problem with this one, or provider is upset about this, or can we move this along? And we're getting that response right away. Um, but also with the volume, because we are increasing our volume, we're increasing our amount of tests too, as
Yeah,
we've
you
got
had two new test
two or
launches
three. Yeah,
this.
and
Yeah.
which was an ordeal. And
Hmm.
we worked with you guys to be like, we're not sure. This is a brand new test. We've never had to do offs for it.
And that
Nobody
actually
in
is
the
a good
industry is
point.
doing it.
Because a lot of them came through as experimental CPT codes, right?
Yeah.
Like, and so we weren't sure how to work them. What do we do? What do we submit? They're brand new tests on the market. So there's a
Yeah,
lot of back and forth in terms of what to do because you have this unsolicited, like, or experimental CPT code that
exactly.
everyone likes to deny because it's so generic.
Yeah. Yeah, and no one else is doing the test, so you're like, I don't even know how to find out what somebody else is doing. But luckily working with you guys, we see, if the turnaround time is creeping up, does that mean you need more help? Do you need more
Hmm.
help from us? Can we take something off your plate? Can you take something off our plate? So we've been talking about that each week, looking at volumes, but then also with the new tests that came in, we really relied on your teams on and offshore to give us the feedback. What are you actually hearing from the payers
Yeah.
right away? And that has helped
Yeah, we
us.
documented it for you guys, right? It's like
Yeah.
this one said we need this, this, this. This one said it's going to get denied or this isn't good enough. Yeah.
Mhm.
There's
And
a
you
lot.
documented it real, like manual, here's your, Excel spreadsheet with everybody's list
Hmm.
and exactly what was being told to us, exactly what was coming back. And then all went up the line to leadership so they can see, real time what's going on with this test and how we can pivot if needed,
Yeah.
what we're asking
Your
providers to.
decision making in terms of how to move these forward,
Yeah,
what flow should be, followed, what
it
is there
helps
roadmaps
everything.
for providers? Like, yeah, what do we need, basically?
Yeah. I mean, it was also the feedback that like we need better codes, things
Hmm.
like that would come up too.
Yep.
Could you give us a write-up of explaining the test? You guys asked for that. So we went to our legal and our medical teams and asked them for a write-up that you can send in with the path, the prior authorization.
Yeah.
So, we've been working together on that and it's been great.
Yes, it has been. It's been a learning curve, a little
Yeah,
bit, but I think we had so many things already set in place. It just made it so much easier. It's like, okay, now we know what exec wants. Like, we know what to do.
yeah,
We know what they're looking for. Here's the data, and you guys are very specific. So, we do have a great team. And I'm very proud of all of them. So
yeah, yeah. And you guys never complained, which is, I mean, to our faces, but you, but we threw a lot at you as regard to
no.
PA.
Our job is to make you successful. So, like, whatever we have to do, whatever you guys need, we're like, okay, yeah, we can't screw this up. So, whatever. Yeah, they want
Yeah,
to, we'll
I
do it.
appreciate that. I appreciate that.
Yeah. Um, so before I open this up to the audience, we have a question that we ask all of our guests. And that is, if you were in charge and could change one thing about the prior authorization process, what would it be?
Um, I,
Taxpayers, because
for
that's
the
an
payers,
but
yeah.
I that, yeah.
I mean, how many things can I list? Um, I would say make PA uniformed. Everyone has their own particular process, their own forms. Even within an insurance company, one plan could go through Carillon, one could go
Yeah.
through Avalon, and then you have another one that has to go to them directly. It's so complicated and so layered that making it streamlined would be, you would move so much faster
Oh
as,
yeah.
you
But I
know.
think that's the intent though. They make it super complex because they don't want it to be streamlined. I mean, my
Yeah.
opinion.
Yeah, and I understand that, I mean, to run like a good PA team, you have to look at both sides of it and all the different conversations happening. The patient who doesn't have a voice in this, and then you have the oncologist who's, working for the patient, and then you have an insurance company that wants to protect their patients but also keep their costs low.
Right.
So it's, you have to really come at it from all sides and understand everybody.
Yeah, that really good points. I mean, that is I would, have to piggyback on that. And I think those are great points. And, I don't know if it'll ever get any easier. It seems like year over year just gets more
Yeah.
complicated. And I hope, especially with oncology patients, like my heart goes out to them. So I'm like, I don't want, like, come on, if there's one thing you're gonna like have to just expedite, then
Yeah.
make it clear in terms of what you need and like let's get you that so we can get this patient seen or that test delivered and the results delivered.
Yeah. Yeah, 100%.
Okay, so let me open it up to the audience and see. We have a couple questions. So, the first question, many labs struggle with payer variability across states and regions. What strategies have you found effective for keeping prior auth workflows consistent despite offering payer rules?
Um, it's just a constant communication, and it
Yeah,
is, I think, between all of us, my team and your team, but also understanding the payers and getting those rules written down too. That if somebody's working, if a one payer, an update where their turnaround time is, I think we had one with Humana. And if we had start the auth without the records, it's a 48-hour turnaround time. We know that's not going to happen
mhm.
to get records in. So we had to pivot. So I think it's a lot of that too, of just working closely together to come
Yeah.
up with the best strategy.
I mean, how many times over the last, I don't know, almost 2 years that we've worked together where you've seen the pair changes? It's like monthly, like,
Well,
or if not
it's
more.
unlike any other time in the industry, they're making updates to medical policy and their processes many times throughout the year.
Hmm.
It used to just be at the beginning of the year, they would review their policy and come out with something new. This one, we're finding that, especially with the lab benefit managers like Carolyn and Evercore, they're making updates throughout the year, but they're also quietly making those updates.
Yeah, I was gonna say, I don't think they notify. Like, it's kind of like,
No,
oh, wow, we just got a bunch of denials. What happened? Yeah.
exactly, exactly. So we're trying to be more ahead of it. But
Mhm.
even like this summer, we had Carolyn updated their genetic testing process. Even though we're a genomic test doing tissue testing, they lump us under genetic, which they changed their data service policy. They didn't announce it. It was
Oh,
nowhere
that's
on their
right.
website.
Hmm.
It was a payer who told us during their like normal little email, their monthly email, that this was coming. And so we had to pull in our legal team and our market access team. And what does this mean? This is going to change the way we do everything. Since we're working off of tumors, that tumor could be 3 months old. So this is not going to happen.
Mm-hmm.
And so they went to Carillon and they had that changed for our testing, for our type of testing. So it's just staying on top of it all and fighting as hard as you can.
Yeah, actually, the data service thing, I forgot about that. That's always been
That was
kind of
scary.
scary. Yeah, like what do we use? Like, is it the order date? Is
Exactly.
it the result date? Like, what do we use? And that's kind of it. Always been a lot of back and forth with that one. And I don't
Yeah.
even think we have a real answer to that because it just depends on payers. There's like a lot of different moving parts in terms of
It's,
what do you use as a true date of service when you
yeah.
get the off.
And it's
Uh,
also explaining to them what we even do because they
right.
don't know. A lot of times they're like, I don't know, it's a genetic test of some kind. You're like, no, it's genomic. We're testing a tumor
Mm.
and we're going through the makeup of the tumor. So it's a little different. It has to do with surgery. So there's a lot of parts of who has the actual tumor to send it in and is it frozen? Is it not frozen? Like there's a lot of things happening that we have to kind of educate insurers on.
Yeah, and it's gonna be constant. I mean, it's never gonna
Yeah,
go.
always.
It's, I mean, they always say, "Oh, power off's gonna go away." I was like, "Yeah, right."
Yeah,
Like, no, and not, that is a lie.
yeah, exactly.
I see one more question. For organizations that don't have the same scale or resources as Exact Sciences, what first step would you recommend to start reducing those authorization delays and denials for oncology testing? Great question.
Yeah. That is a great question. I think that one thing that we have with my team is understanding the why of what you're doing, know these tests inside and out. And we've educated your team as well as in-house and my team. Um, why are we doing what we do? Understanding and becoming passionate about it. It's easy to become passionate about oncology because you see the patients
Mhm.
names, you see their ages, and you see what's happening to them in their medical records. So you do want to fight for them, and it's important to have that passion behind you because you will go the extra step. It's also finding that when you're talking to a payer, it's you have to sweet talk them too a lot of the time.
Yes. I
I've
tell my team, I'm like, look, they could have a bad
yes,
day, like just like all of us. Like
exactly.
you never know who
Thank
you're
them
gonna
for
talk
what they're yeah, thank them for what they're doing. And I've gotten ahead so much information from a payer just because I was on the phone with a rep and I'm like, how is your day going? Where are you located? Da, da, da. Like, how's the weather down
to.
in Louisiana? And and we're chit-chatting and then all of a sudden she's helping me.
Yeah,
Um, or
being
he's making an
empathetic.
extra call. And it's like, okay, so from now on, where do you want me? How do you want me to process these for you? And we're working together on a goal. So a
Yeah,
lot of that came together and then keeping documentation of everything too, which both of us are pretty used to. Um, letting, us know exactly like this is the phone number you called, then you hit option two, and you're gonna speak to a woman named this, da, 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 and then you're gonna ask for this person, write it all down.
yeah,
Make your life easier.
exactly. Yeah, or transcribe or record
Yeah,
anything.
well now in AI.
Yeah, exactly. Now that you can record the calls, you can get transcriptions. It's like all there.
Yeah,
But I do think I think that's what's made us super successful with, Exact Sciences. We both care. Like, I mean, our teams
yeah,
absolutely have a lot of, we care. We've all had someone that we know, family members, friends who dealt with some type of cancer, something. And so like it's, very sensitive subject. Like being empathetic does matter. Whether
yeah,
you're dealing with a pair that we all don't like, but
yeah, yeah, it's true.
well, Liz, thank you so much for the conversation today. We are super grateful that you're able to join us and share your insightful, feedback and just kind of your understanding, your point of view of things because it does matter, it does. And everyone else is facing the same type of problems in the industry. It's not just Exact Sciences, it's not just Infinix, it's
Sure.
everyone. So thank
Well,
you
thank
all for
you.
joining us on Office Hours today. If you'd like to watch past episodes or learn more about our upcoming topics, you can find them on the Infinix website. Until next time, take care, and we'll see you at the next Office Hours.